Hello everyone. Today I discuss about the instrument. So I discuss at part 1 sponge holding forceps, uterine sound, double bladed vaginal speculum, self-retaining vaginal speculum. At first I discuss about the sponge holding forceps. Sponge holding forceps parts is fenestrated blades, jaw, fulcrum, long and thin shaft, catch lock and finger bow. Then I discuss about the sponge holding forceps uses. কি কাজে লাগছে এটা? Cleaning the operative field and antiseptic dressing, deep mopping, clear the area during the surgery, to catch and hold the cervix for the inspection in suspected cervical tear, and to hold the cervix during the cervical enlarge operation. It can be substitute in the place of an ovum forceps. Then I discuss about the sterilization process. To dip the instrument in 5% hypochlorite solution for a 10 minutes, then it is to be cleaned with the soap and then running water. After that, it should be autoclaved for 20 to 30 minutes and 15 to 20 pound pressure and at temperature of the 121 to 125 degrees Celsius. Then I discuss about uterine sound. It has 3 parts. First is olive pointed tip, body and board handle. Then I discuss about the uterine sound uses. কি কাজে লাগে এটা? Routinely use all gynecological operation and act as a first dilator to dilate the cervix, to know the position and length of the uterine cavity, to dilatation of the cervix in the DE operation, to sound the uterine cavity to detect any foreign body with missing thread. ইউটেরাইন সাউন্ডের কিছু কন্ট্রাইন্ডিকেশন রয়েছে, মানে এটা কী কী ক্ষেত্রে ইউজড হয় না। যেমন প্রেগনেন্সির ক্ষেত্রে আমরা ইউটেরাইন সাউন্ড ইউজ করব না, এবং পেলভিক ইনফ্ল্যামেটরি ডিজিজ যদি থেকে থাকে তাহলেও আমরা এটা ইউজ করব না। দেন আই ডিসকাস অ্যাবাউট দ্য স্টেরিলাইজেশন। কী আছে স্টেরিলাইজেশনে? ইনস্ট্রুমেন্ট আর দ্য প্লেসড ইন এ সার্জিক্যাল প্যাক অ্যান্ড এক্সপোজ টু এ স্টিম আন্ডার দ্য প্রেশার ইন দ্য 120 degree Celsius temperature in the 15 pound pressure. Then I discuss about double bladed vaginal speculum. Double bladed vaginal speculum have 2 blades and shaped with a groove. Then I discuss about double bladed vaginal speculum uses. এটা দুইভাবে আমরা আলোচনা করব। একটা হলো গাইনোকোলজিক্যাল, একটা হলো অবস্টেট্রিক্যাল। গাইনোকোলজিক্যাল এটা কী কাজে লাগে? ইন ডিসি অ্যান্ড ডিই or for taking a biopsy from the genital tract, in operation of cervix and vagina in lithotomy position, or obstetrical এটা কী কাজে লাগছে? To inspect the cervix and vagina to detect any injury following the delivery, to clean the vagina following the delivery, to inspect the cervix and vagina to exclude any local causes for bleeding in APH. এবার আমরা দেখব স্টেরিলাইজেশন প্রসেস। At first the instrument is to be cleaned under the running water, then soap water and again in running water, then autoclave. It is the most common method of the instrument sterilization. Instrument are placed in a surgical pack and exposed in a steam under the pressure 120 degree Celsius temperature, 15 pound pressure within the 15 to 30 minutes. Then I discuss about self-retaining vaginal speculum. At first it has anterior blade, then friction screw, handle and posterior blade. Then I discuss its uses. Can be used without any assistant to visualize the cervix and vaginal fornix for any local causes of the APH, to inspect the cervix and to prepare the cervical smear for the cytology scanning, then to detect the leakage of liquor from the cervical os in case of the suspected PROM, then in insertion of IUD, then to reach into the cervix to apply the medication and to take the swab for CS. Then I discuss about the sterilization process. At first, the instrument is to be cleaned under the running water, then soap water, then again in running water. Then autoclave. It is the most common method of the instrument sterilization. Instruments are placed in a surgical pack and exposed to a steam under the pressure within 15 to 30 minutes.